Okay, good afternoon, everyone. This is Shirley Wong, Houston, from the Houston Health Department, and I'm a health educator, senior public health educator from the Chronic Disease Education Unit. So nice to be with you to talk about our COVID-19 updates, tips for our summer traveling for the Chinese Cultural Center in Houston. So as we already had a Chinese session in the morning, this is the English version, English session. So it's nice to have you have your phones ready. And if you could see the chat box, you could jot down your questions. And we will have a live discussion after the presentation. And then finally, we will have a session of uh, and a question Q&A, and then you could have an interactive session with the answering, and we will have a gift card for the fast and correct recipients at the very end of the presentation. So nice to have you. Welcome everyone. So I believe that most of us have been living in this pandemic situation in the past year, and we have been wearing a mask a lot, and some of the instruction lately have been telling us that we could take our mask like in some situation if you have been fully vaccinated. So very good. Are you still washing your hands often for at least 20 seconds, keeping your social distancing in certain areas when it is very crowded? And have you been doing testing in some situation? Most obviously, getting vaccinated will be the most helpful tools to prevent COVID-19 from spreading. So today we've got some news with you. This is the situation in June, but we're not talking about it now. We're jumping to July. Since the 19th of July, the situation overview now in Houston is we've had a dramatic increase in the number of COVID cases because of the Delta variant has been really significant in our Houston area. And just this afternoon, just updated, we've received the Harris County COVID level alertness. We have jumped from level 3, moderate, to level 2, significant. And what significant means is uh, we have to take like more precautions, minimize the contacts with in this like social contacts, just prevent. So we have become more vigilant now. We have to, because reporting from Delta variants has already made 83% of the COVID cases as of July 19th. So this massive increase just happened in July, and it has caused COVID fatalities, the death rates, of about an increase by 48% since July. And on an average, we have been having around 239 deaths per day in the country. And the COVID variant Delta has been reported as even higher in some countries with low vaccination rate. So Delta is considered as a more uh, transmissible variant of COVID. And this is now we have to be more vigilant now, and our alertness level has increased from moderate to significant. And remember, last year, this time, it was severe, so level 1. Now, it does vary, and as according to the director of CDC, Rochelle Walensky was saying on the 19th of July on the new CBS News, and which I've captured here, she was saying that we have to get vaccines, be vaccinated, so that we can neutralize the circulating variants in the US. And the best way to prevent the spread of COVID variants now is by vaccination. So if we want to save time, we jump and not to watch the video of the news. But here is the news clipping that I clipped from CBS Evening News. This graph shows the vaccination rates in blue columns from April to July, the 17th of this year. versus the orange column, spiky columns are the appearance of the Delta variant. So it's very clear, as you can see, that the number of vaccination drops from April to July. The variance is like gradually rising. Delta variant has appeared in our society since almost like May, June, and is surging up to 83% as of July 19th. So this is bad enough. So we have to be more vigilant now, because we know that this Delta variant is more transmissible. Now, with the Houston Health Department, we are providing statistics, and this is like now gone up. Okay, Houstonians fully vaccinated percentage is, as of July the 11th, has been 57.5%. Fully vaccinated means that you have had your vaccines taken twice, like 2 shots for Moderna and Pfizer, and Houstonians with the only first dose taken of these two types of vaccines are 62.1%. So it means, and this is excluding the J&J. J&J, if you had one shot, you'll be considered fully vaccinated. So we are not reaching the expected requirements by the states by July 4th. We were expecting to have like 70% to reach fully vaccinated in order to reach a herd immunity effect. So this is number one. We are actually behind with our fully vaccination rate. And let's look at the right-hand side, the age breakdown. We can see, starting with age 60 plus, we can see these elderlies, they're really good. Like 93.2% of these age 60 plus elderly, they have been vaccinated. That is really, really promising. Very, very, looking very good. But as the age ranges go down, you can see that people who are age 12 to 15, they have got the lowest fully vaccinated rate of 80.1. And you can see that below 12 years old, we do not have any vaccine provided for them yet. Not until later in the year, as I know. So how are we going to protect the young people? Okay, if you're above age or 12 or above, you can encourage them to take a vaccine, because they could really take the vaccine because they are above 12 years. But if they're not over 12 years old, you would have to continue ask them to wearing a mask, washing their hands, keep social distance. Now, this is a comparison of the two types of vaccines that we have. On the right-hand side, we have vaccines are made by this mRNA COVID-19 vaccines made by this method, manufactured by mRNA method. So we could clearly see mRNA are just strands. They are carried into a shell or an envelope, and then in the vaccine you have this like contained in the vaccine product, and then you inject it into our body. And what this is trying to say is the mRNA that is signaling us to make the antibody, but it doesn't. The mRNA would not get into your DNA of your cell, so it would not alter your DNA, to clear some of the myths in the community. On the left-hand side, we have another type of vaccine that's made by a viral vector method. This is written in Chinese. A viral vector is just a carrier, so it carries the mRNA, it carries that piece of genetic material by a carrier, which is a adenovirus, and then it goes into the vaccine product, and then you get the jab, you get the shot. And what this is trying to illustrate is, once you get the viral vector vaccine, e.g. Johnson & Johnson vaccine, is going to go into your body, but it will not go into DNA of the cell. Again, it will not alter your DNA. It will only help our immunity to produce these little Y features called antibodies. So, for example, viral vector or mRNA manufacturing methods of vaccine, in conclusion, they do not change your DNA, but they will only help to produce antibody to boost up our immunity against COVID-19 viruses. Now, the comparison of the vaccines that we have in the US market now, we we actually consider very, very lucky because we have a choice of which vaccine to take. We could actually choose in some Asian countries or some like less developed country, they are still waiting for vaccine to arrive. So their lack of vaccine. So we're actually very fortunate, and we could just look at how just briefly what's the differences between these three types of vaccines. Like we have Pfizer, we have Moderna, and these two types belong to the mRNA method. They were manufactured by mRNA method. Both of them need 2 shots, and the recommended, the recommended dosage, the recommended age, on the right hand side. Main difference is Pfizer is applicable to children who are 12 years or above, but Moderna, you've got to be 18 years old or older. Now, looking at the bottom, we have Janssen. Sometimes we call it J&J because it's manufactured by Johnson & Johnson. This is the viral vector method. It was manufactured by the viral vector method. That's why we have a slightly dose difference. You only have to have 1 shot for the Johnson & Johnson vaccine, and you've got to be aged over 18 or above. Let's look at their comparison of the efficacy. Efficacy simply just means it is the rate of effectiveness, against COVID infection. And we can see from this table, Pfizer gives you 95% efficacy, Moderna 94, they're good enough. Johnson & Johnson 66% globally and 72 in the US. So overall, still Pfizer has the highest efficacy and is applicable to even children above, or people who are above 12 years or older. They all have side effects like fatigue, muscle pain, headache, but they will subside after 1 or 2 days. So let's have a look at this picture. Most of the symptoms that's reported for COVID-19 are the cough, the chills and fever, muscle, body aches, or vomiting, or diarrhea, or a change of smell or taste. But they will usually go away after 1 or 2 days. And even if you've been infected or you contracted with COVID, you have been positive in the past, but you recovered. Once you're recovered, then you should really get vaccinated again because it will give you immunity by making more antibodies. And most importantly, these vaccines that are available in our US markets, they are all free and they do not require you to present any ID or proof of residency or proof of citizenship or medical insurance. You could go without any of this and you just walk in any pharmacy or medical center or healthcare center that's provided by the health department. You could just have it done there. So they're all ready for you. Now, this is a comparison with the reported side effects between the Moderna and the Pfizer vaccine. As you can see that probably, when talking about pain or muscle pain, there is a higher incidence of reported muscle pains in the Moderna against the Pfizer, but basically they are pretty much the same in the reported symptoms like tiredness, chills and fever, joint pain, muscle pain, and headache. And when are we considered fully vaccinated? Okay, if you have been taking the Moderna or Pfizer, you have to have 2 shots, and after 2 weeks, after the second shots, you will be considered fully vaccinated. So you will be protected fully immune after 2 weeks of the second injection. Now, if you've had the Johnson and Johnson vaccine, which is just one shot, it requires only single dose, and you have to wait for 2 weeks for it to be effective to be called fully vaccinated. And if you have forgotten to go back for the second shot for the case of Moderna or Pfizer, please go back as you're scheduled as quickly as possible, because you would not be considered as fully vaccinated, and the protection is not as high. The efficacy could not be as high as the reported. Okay, let's look at the benefits of these fully vaccinated people. So this is extracted by the CDC for COVID. These are the benefits. You see the smiling faces of these fully vaccinated people, and because they have been fully vaccinated, then they are able to go to these activities no matter indoor, outdoor, and they are not required to wear mask in many of these places. But I tell you, these instructions have been ever changing. And just because of the surge of the Delta variants in July, I know in the state, Los Angeles, in California, some places they are requiring everyone to wear a mask, regardless of your vaccination status now, starting from this week. So this is just a general idea, but depending on which city or each state, you may have a different instruction now. But generally speaking, if you have not been fully vaccinated or unvaccinated, you have, when you attend some outdoor meetings, like a crowded, fully small gathering with outdoor restaurants, with people eating, from different households, these people coming from different households, or you go to open air live concerts, then you would have to wear a mask. So the crowdier the event outdoor it gets, the higher the risk. So red means it's a high risk activities, even if it is outdoor, and you should wear a mask. And okay, sorry, let's go back. If you are indoor, we are considering indoor air activities like in a hair salon, museum. It was recommended that fully vaccinated people do not have a mask earlier, when it was like down to level 3 with the Harris County alertness level. Now, a lot of places keep changing the signs on the door. Sometimes they say mask encouraged or mask required as the situation gets more severe every week. So look at these indoor activities. What are the lighter risks? One will be just going to a hair salon to have your hair cut, but it would be like amber. But when you go to indoor choir practice inside the church, or inside the church worshiping, and these would be considered red, which are high risk activities of higher risks. So we would be required to wear a mask, and it's better to wear a mask even if it is not required. Okay, traveling. It is summertime, so would you take your kids and yourself to traveling? We were not able to do that last summer because the pandemic was severe. Now, a lot of the American people, we've been thinking to take our kids, or at least for domestic travel, sometimes you may want to travel within the US. So you are not required to do COVID testing before or after traveling within the US, or self quarantine after travel, as long as it is within the United States. But I know some of the international destinations, if you're traveling abroad, overseas, you have to be careful, because it really depends. The requirement of showing your the COVID testing reports does vary between countries. And if you're going to some of the Asian countries like China, Taiwan, Hong Kong, a lot of times the destination would require you to get a testing report before you take off. leave, say, the US. So this really depends on the location where you're going. So it's better for us to check in advance. And I know for China, it is strict that strictly requiring people who will be boarding by flight in China to get a testing reports by checking the antibodies level. So you draw blood 2 days prior you take off. So if you did it earlier, like 5 days, sorry, no good. And I know some of these testing facilities, they are available in airports, but at a charge. So if you're thinking of bringing your family to go back to China or Taiwan for a visit this summer, you might have to consider the cost of doing this tests. No matter the PCR test or the antibody test by drawing blood, they do have a cost. And because they turn out the result fast, like you got to show it within 2 days, it's got to be fast. So usually they charge you. And if you have the report negative, the COVID testing report is negative, everyone can go as planned. You can board your flight happily and fly off for your trip. But if one of the family member has a positive result after this testing, you got to make arrangement for her or him to postpone, delaying the trip for that person, or whether the family can go together. It really depends on the report. That is very important. So it is advised that you do the testing 3 to 5 days after you come back from an overseas country to America. You still need to do testing after you come back from holidays. So just to keep watching whether you have symptoms or not, and do the testing after. So now this is a table about domestic travel advice and international travel advice. If you're against whether you're fully vaccinated or not vaccinated. So this was a CDC instruction announced earlier in February, but sometimes we change our instructions from the CDC according to the pandemic severity. And it was like usually fully vaccinated people enjoy more benefits, and because they may not be required to do a testing 1 to 3 days before they travel domestically. And watching for the self-monitoring of your own symptoms and wearing a mask during traveling, taking precaution, is always required in domestic. And for international travels, if you're fully vaccinated, you may not, or may, depends where you're going, the country's requirement. And also, when you come back to the US, it is required for us to have your COVID tested. So before you fly back. So in the country where you're staying for your holiday, have your COVID testing done there before flying back to the US. So when you come back after 3 to 5 days, you still have to get need to get tested, no matter you're fully vaccinated or not fully vaccinated. And if you're not fully vaccinated, you must self-quarantine after travel for some days, 7 days, or for negative results. Okay, let's look at this. Before you travel, this is like a chart, before you go out, 3 days or less than 3 days, sometimes you have to do your testing for traveling overseas, especially if you got a negative result, good job, you could go to travel. But if you got a positive result, do not travel, and you have to postpone your trip. Okay. And follow public recommendations for isolation. Now, after you had your holiday overseas, when you come back, this chart just tells you have to go and get tested within 3 to 5 days after you arriving back to America. And if you got a negative result, congratulations, everything goes back to normal, but stay home to watch your self-monitoring of symptoms. take precautions because it may be just like hibernating, watch out for symptoms and still take precaution like wearing a mask. But if your testing 3 to 5 days is positive, then do not go anywhere around. Immediately isolate yourself, and then if you did not get tested 3 to 5 days after you come back from your trip, you should stay home for 10 days and self-monitor, and during that period take precautions and self-monitoring for symptoms. So this is very helpful to know before and after travel to play safe. So who should get tested now? People who have symptoms certainly need to be tested. But even if people who do not show any symptoms, but they have not been fully vaccinated, they should really do the testing. And especially when you've been in close contact with anyone who's confirmed with COVID-19 positive, you should also get tested. Um, and also, when should you go and get tested is when you've attended some of the higher risk activity, like we said before, like worshiping in a church, in an indoor area with lots of people, crowded, music concert, indoor, this large scale social mass gathering. Sometimes if you go to a plaza shopping, lots of people, you should still do a testing because it is crowded. It is indoor. So visit our HoustonEmergency.org/COVID-19, or, for a free vaccination site provided by Houston Health Department. Or if you find it easier, just go to a pharmacy near home to get the vaccine or get tested. Okay, facts. Let's do a little summary of what we could learned, safe and effectiveness of the vaccine. The COVID-19 vaccines can protect you significantly from getting seriously ill. It's been done. These research and evidence has been collected from different races, different people, diverse ethnicity in large clinical trials. So we could conclude that having COVID vaccine can protect you from serious illness and death. So getting vaccinated, okay, and other advertisement advice from Mayor Sylvester Turner early on, you could go to one of the Houston Health Department provided health center. We also have a service provided by the Houston Health Department called free transportation, and you could get your transportation fees, claimed back. I think it's $15, something like that, by getting an Uber or getting a Lyft. So, but if you're seriously bedbound at home, so you might need someone to come to your home, well, there is also a home vaccination service that we're providing. All you have to do is just log into, visit this website, and you're able to see the service that we provide, no matter it is free transportation by Uber and Lyft or a home vaccination service. Other than the permanent sites, we also had some pop-up sites by the health department. So provided these are the fixed sites in different health centers, our Del Mar Stadium, NLG Stadium, rodeo parking lot. There are also, other than these permanent sites, we also have many other pop-up sites over the weekends. They only operate for 1 or 2 days, shorter durations, but they're more like variable, like different locations rotating throughout the city. So they're always available for you if you want to get vaccinated. This is just a form showing that for minors who need their guardians or the parents consent to get the vaccine. So this is a consent form if you are having a vaccination for a minor. Okay, now we've talked about all the vaccination facilities and services we provided by the health department. Now, if in the summer you want to just take your kids and yourself to the pool. We also really concerned about our summer safety. During travel, during a trip in a hotel, you may want to just like jump into the pool with your kids. Always make sure that you swim in a pool with like supervised by lifeguards, especially when you have children. And don't go alone. Don't go swimming alone. Always go with a buddy. Uh, Always wear a life jacket when you're on a boat trip, when you go abroad to have your holidays. And often we jump into the pool, but watch out for the kids. Children should never be in the pool unattended. Also, have some kind of safety facilities beside the pool. So if someone gets drowned, just throw out the throat. So water safety. Now, out of the water or, playing with water, we need to protect our skin as well. So safe summer travel when you go out to the beach, to have a day in Galveston. The sun in Texas is really strong in the summer. So we need to protect ourselves, our skin, by putting on sunscreen. And if you look at the bottle, that, is sometimes you'll find the word SPF, and SPF, the number, the figure 15 means it blocks away 39% of UV ray B. SPF 30, higher protection, it blocks 97% of the UVB. And SPF 50, so blocks away 98% of UVB, ultraviolet light B. And if you look at the differences between SPF 30 and SPF 50, so the difference, the end result protection is just like 1% from 97% blockage of UVB to 98%. So if you're buying a sunscreen lotion, which is like a lot more expensive because it says SPF 50, look at it. It is not that price, it's not a really good bargain if you're only like rising the protection by 1% if you're paying a lot of it. If you can buy a cheaper one of SPF 30, which is the most common type of sunscreen, by just applying it more often. That would be more economical. Now, how do we choose our sunscreen? Now, sunscreen, we have something like, on a bottle, it says broad spectrum sometimes. So, oops, sorry. Let me go back. We want our sunscreen back. Sure. Let's move it out of the way a little bit so that we can see the broad spectrum means, if you see broad spectrums, that means it blocks away ultraviolet light A and ultraviolet light B rays, both types, because both UVA and UVB can cause skin cancer. So we don't want people having skin cancer from either of these types of UV. So we have to buy some broad spectrum sunscreen lotion. There are reported 1 in 5 Americans will develop skin cancer in their lifetimes. So we really want to go out in the sun with protection. And the SPF, as we said earlier, most common type 30, but you can buy 50. It just tells you the protection from sunburn, and also water resistance. If you see water resistant, the word water resistant, it just means it could be protecting you 40 minutes from the time of application. So after 40 minutes, like if you've been in water or if you've been sweating, you need to reapply that lotion after 40 minutes. If you see a bottle that says very water resistant, then you could reapply that sunscreen lotion after 80 minutes. Okay, sunscreen protects us from skin cancer. Now, what about our eyes? We got to protect our eyes as well for vision. It's better if you get your sunglasses with protection against UVA and UVB. When you're out in the sun, just to protect our eyes. So now, mosquitoes. Now in the summer, especially you go outdoor, do your outdoor activity with the kids in the wilderness, in outdoor, sometimes in the park. There might be just like some mosquitoes. So you might want to protect yourself by wearing long sleeve or long trousers, pants, and try to avoid going out during dusk, like 6 to 8 now, because sunlight is longer. But mosquitoes like to come out to, outdoor during dusk. So if you could prevent going out during that time, or at least wear long sleeve to protect you from either sunlight or from mosquitoes, and try to empty, if you see water pooling, empty these stagnant water. And if you're just traveling, protect yourself. You may want to use repellent, but be careful with the labeling on this mosquito repellent. We encourage you wear long sleeve, thin jackets, but long sleeve. We know that mosquitoes are the carrier of Zika virus, and Zika virus, once it gets into your body from the mosquito bites, you are going to have red eye symptoms like red eyes, headaches, rash, joint pain, muscle pain, or even a fever. So the best way to protect us from contracting Zika virus is to prevent mosquito bites. So um, let's look at another danger, like in the summer travel, or during our national day. Sometimes we play fireworks, but always supervise your children and even adults. We every year on July 4th, night after July 4th, we always have a lot of burn casualties, or critical care units receive a lot of patients from injuries from firework. So they're not running away fast enough. You got to stay away back, because it is an explosion. So to protect us and supervise your children play fireworks. So we've talked about a lot of this summer traveling safety today, including COVID-19 prevention and some of the water, mosquito, sunlight. Okay. Um, Next month, we're going to advertise for next month. We will have 2 more talks in August, August 19th, 6 p.m. We have a Chinese version, August 20th, 11 a.m. We have the English one. The title in August will be Back to School Safety. We are back to safety now, but we are preparing our kids to go back to school safe, as it is announced by a lot of ISDs. Kids will be going back to school for face-to-face classes in fall. So we have to prepare our kids, get them, masks for children's size. And if they are over 12 years old, you may consider having your kids vaccinated this summer and get them ready for next month for school. So you want to register again, come to our virtual class, just to uh, get some more information for getting ready to go back to school. Also, the Chinese Community Center will offer vaccination services, so we can do this. We can log into this website and just or for a vaccination appointment. But I know there are a lot of pharmacies or health center clinics that are providing this vaccination for COVID-19 without not even having to register now. But you can click for more information here for we can do this. Now, Better Together is an education series. So at the moment, as we are going back to a Delta surge, so we encourage to still wash your hand frequently, at least for 20 seconds, still wear your mask properly in some of the places, crowded, indoor, still keep your social distance, and get tested when you need to. So and everyone wants to go back to our life previously, but without taking enough precaution, we may not be safe enough to go back to these activities. Now, I would like to invite you to partake in our post-class survey by using a scanner to scan this QR code. Or if someone could help me, please put this link for our post-event survey. It's very short, so we could make improvements in our future talks at the CCC. It'd be really appreciated if you could spend time, just like 2-3 minutes, and fill out the survey now, because the next session, when we have our game, and we will have a winner who will receive a $25 gift card in the game. So please submit your survey, and we will consider those the eligibility for playing the game. Is you fill out this form to tell us how we perform in this class. Thank you very much. If you want to take a picture of the scanner, or if you could just um, click the link in the chat box. I think it may be already available there. Now I will come off my screen control and go to the chat box and see. Ooh, am I out?
No,
So that
we still see your screen.
Okay, let me pause sharing. Yes. Stop sharing. Now, welcome everyone. So, if you had some time just now to log into our post-class survey, very welcome to submit it. Nice to see everybody here. You could do it after the class, but as long as you do it within today is also fine. But it is an eligibility. If you are very fast in answering the questions now, I'm going to ask 3 questions. And if you're fast in typing, and if you're fast responding, you might have a chance to win a $25 gift card. And if you want to practice, I will open my chat box and see, you could type the word testing in it. Wow, just to make sure the keyboard is working. And are we all getting ready? Now, we, as a requirement from the health department, we do ask you to submit your post-survey form for our improvement in order to, win this game. So hopefully participants will submit that, but we will play the game now. Getting ready, everyone? I have my first question for you. If you've been listening carefully for Shirley's talk just now, my first question is, which brand of the COVID-19 vaccine has the highest efficacy rate? Okay, you got to type
Pfizer.
it. You have to type it in. You have to type it in. Yeah, this is why I asked you to practice typing. Okay, I see the results, the answers from a lot of the participants. That's really good. And most of them have got it correct. The correct answer is Pfizer. Pfizer has got the efficacy rate of 95% and is considered the highest amongst the 3 types of vaccine in our US market. Very well done, everyone. Okay, let me ask my second question. So, let me see. Ooh. Ooh. Thank you for your response. Here is the second question. You just have to answer yes or no. Not to say oh, remember? It's a typing game. Okay, you have to type in the answer. Shh, don't tell your neighbors. Second question is, do I need to have a proof of residency to receive a free vaccine? Come on. More answers, please. Participants. Wow. Very well done. Very well done. And I do certainly identify a few fast typers here. You're really, really fast in your response. Good. Now, question number 3 comes. Which animal is the carrier of Zika virus? Which animal? And you've got to spell it correctly. Which animal is the carrier of Zika virus? Come on, come on, come on. Okay. So let me see your response. It's interesting though. This question, I haven't got all the answers correct. Like before, like in question 1 and 2. Previously, you guys are very smart. Everyone got the answers correct to questions 1 and 2. But this question is probably some people are correcting the spelling. Okay, I see. Yes, the correct answer for this question is mosquito. Mosquito. So very well done. And okay, I see the first who got it, the question 3 right. Okay. So we would have to round up, these results. Uh, thank you very much for your participation. And as I could see from the response and the rate you typed, Miss Judy has come first in the first and second question, fast and correct. But Miss Judy was the second fast in question 3, so she only got 2 out of 3 marks, 2 marks out of 3 marks. Miss Charlene has got question 3 right and the fastest, quickest. But overall, Miss Judy has, because she answered question 1 and 2 correctly, the answer for question 1 was Pfizer. As I said, Pfizer was provided the highest efficacy. She got it right. And the second one, the answer is no. I don't need any proof of residency to get a free vaccine. Miss Judy got it fast and correct as well. So question 3, the answer is mosquitoes. So mosquitoes. The winner today, may I announce the winner of our gift coupon, cash coupon will be Miss Judy. So make sure you submit a response for the survey, and we will contact the winner by post. We'll let you have the gift card by post. So Miss Judy, would you like to show off a little bit and leave your contact with me, by chatting in the chat box to PM, a personal message to me, and so that I could have your email contact, and then probably your address for posting. So if you don't mind doing a text message here for me privately, make sure you're accessible, or otherwise we would have to find a second winner if you don't respond to me. So it's very enjoyable today to have all of you participating. I thank you all so much for your valuable time, and I hope today's talk on safety and traveling tips during this pandemic has been helpful. So thank you very much, Miss Judy, for your email submitted. I will contact you further through this email and get your postal address later for posting this gift card. Don't forget, if you didn't type fast enough, no worries. We will have another round in August. So until then, take care and care for your family, care for yourself, and continue to have a very lovely summer holiday. Thank you, everyone, for joining. I really
Sherry,
enjoyed
we
it.
actually have 3 questions.
You have some questions. Wow, good.
I think they're at the beginning of the chat. So we have one question. It's asking, why do you think the vaccination rate is low for age 12 to 18?
Yes, there has been a lot of controversy. The reason is being people think that they're more vulnerable. First of all, they are children. Even though the FDA has approved the vaccines to be used in these groups of children, but amongst all the other ages, they are the youngest. So somehow they are considered more vulnerable. And also there has been reported cases of endocarditis, which is the heart problem. But the rate, I do not have the most updated one, especially in this group, but there has been reported cases. So like any other of the side effects, they have been reported. So parents may want to, wait and see, just like we were when the vaccine was all, first appeared in the market. We wanted to wait and see, let somebody do it first. This kind of, reaction, this is how I see it. But as school is going to start next month, and it's going to be face to face, and children under 12, they are not protected. And children who are 12 to 18, the vaccination rate is low. We got to think of some ways to protect these teenagers and children. Yes. Is there any question?
Second question from Judy. Which is the best for Chinese people, Pfizer, Moderna, or J&J? I guess Jenny might mention one was best.
Okay. Oh, sorry, what did you say? Just the very last, Jenny, Judy's?
Jenny Mai mentioned one was best. I'm not sure who's Jenny Mai.
Okay. Well, my response to that question is you really have to seek your health provider's advice. We had a slide showing the comparison of the side effects, of Moderna and Pfizer, and it seems to is evident that Moderna has a higher degree of like some pain in the muscle and joint. But if as to advise you, I would just see it does vary from person to person. The response, the pain location, the degree of pain, it varies between people to people. So I wouldn't say there is a best recommendation for Chinese people because there are still very different genotypes amongst Chinese. My ache may be, I'm not aching, but I vomit a lot, so you do not know. I wouldn't give an advice for that. But if you want to compare it with like Pfizer, which is more meaningful to compare it, this Pfizer, Moderna to compare with J&J is more meaningful because it's made by a different method. So you might need to seek the advice from your doctor. He will be able or she will be able to tell you more about it. But from me, I would not have a certain recommendation for Chinese people because they're all effective against COVID-19 transmission. One thing I could tell you is all three kinds of vaccine, no matter Moderna, Pfizer, or J&J, they will prevent you from getting COVID transmission and contraction. All the hospitalization, I would say not all, but 99.5 or 99% of the hospitalization due to COVID at this moment are the unvaccinated people. So my conclusion is if you got vaccinated for COVID, you got a vaccine, it will give you the protection from being seriously ill or, having to end up in a hospital. So this is my advice. No matter which brand, no matter Pfizer, Moderna, or J&J, you're still fully vaccinated. You're still protected. Thank you. Is there any other questions?
Yes, there's one more. It's from Shirley. Do you have data comparing the efficacy of each vaccine against Delta variant?
A vaccination against Delta variants.
Yes.
Delta variant has been changing quite a lot. So I would like to go back to the slide. Because it's quite a new variant. Certainly, I do not have that updated figure. But can you see my screen showing the chart now? Yes. Can you see a chart of the vaccinations and the Delta variant? Although I do not have the the figures, but this chart, which came out from the CBS Evening News on July 19th, this is a study, provided by the news that we could compare as the vaccination rate went down over, May, June, July. Vaccination has been, because people who wanted to be vaccinated would have been vaccinated. So the remaining unvaccinated people are really hesitant, or they are against vaccination of COVID-19. So it's going down. Vaccination rate has been going down, but the Delta variance is arising. So this is all I can give you. I'm sorry, I don't have the most updated statistics because Delta has already reached a high, I would say, prevalence amongst all the COVID patients, 8 to 83%. So this is all we know now. It is the major variant. Out of 83% of all the COVID patients, they are infected by the Delta. So the Delta variant is very transmissible. So we got to take precaution now, high precaution against this variant. If you haven't been vaccinated, please be going get vaccinated and continue to wash your hands, wear your mask, just be vigilant. Is there any more questions? Thank you for your questions, though. Thank you.
That was the last question.
That was the last question. Okay. Thank you all very much. And congratulations, Miss Judy, for your fast typing and all your participation. So I wish to serve you all again in the future events of the CCC. If you like to come to Shirley's vaccination class or other health education topics, do watch out for CCC's calendar or our promotion. At least we know there will be one in August 19th and 20th. Until then, take care and protect yourself.
Thank you all so
Have a lovely
much.
time. Thank you all.
Have a lovely
Goodbye.
evening.
Have a good evening.